Hello everyone, I'm Turuhuchire Peter Jr. I'm with Msao David Nyamlangwa, a medical clinic officer. We are from Bulamu Home Doctors. As Bulamu Home Doctors, we have an initiative where we want to educate the community on different range of conditions. Without wasting time, today we are taking you through sickle cell disease. Msao David, sickle cell disease is on a rise these days. Can you explain to us what is sickle cell disease?
Thank you so much, Mr. Jr. Sickle cell disease is a global burden affecting 70% of the people worldwide. And in Uganda, to be specific, it is estimated at 13%. And 15,000 children are born with sickle cell disease each year. So what is sickle cell disease? Sickle cell disease is a hereditary blood disorder that affects the red blood cells. Thank you.
Msao David, you said that sickle cell disease is hereditary. So for me to have sickle cell disease, I have to inherit it from my parents.
That's right. For someone to have sickle cell disease, they must inherit 2 copies of the sickle cell gene from both parents, and this is what we call autosomal recessive inheritance. And if someone happens to inherit a single copy of the sickle cell gene, these people are called carriers, and normally these people, they do not show symptoms. Thank you.
Okay, Musao, you said it is a red blood cell disorder. So how are these red blood cells affected?
We know that the red blood cells are responsible for transportation of oxygen throughout the body with the help of a protein called hemoglobin. A normal red blood cell is supposed to be round and flexible, which makes it easy for it to move through the blood vessels. But in sickle cell disease, these red blood cells, they change shape to a crescent or sickle shape. This makes it hard for them to move easily through the blood vessels. And this causes a number of complications or problems.
So how do these people present?
Usually the symptoms begin as early as 6 months, although it might be hard to tell whether your child has sickle cell disease without doing a test. But usually you start seeing your child becoming irritable. They will have painful swollen joints, especially in the fingers and the toes. They will have signs of anemia, for example, pallor and body weakness. Then we shall have pain in most parts of the body. For example, in the chest, they will have acute chest syndrome. Then in the abdomen and also in the penis, what we call priapism. Then others will present with stroke due to blockage of blood supplying to the brain.
Thank you very much. Can you briefly summarize for us the investigations and management of sickle cell disease?
Thank you so much. There are a number of investigations that can be done. The doctor will suggest a CBC and HB electrophoresis to confirm whether you have sickle cell disease. Although there are other baseline investigations that can be done, for example, BS to rule out malaria and also a urinalysis. Now for management, this involves both supportive and pharmacological management. For supportive, we always encourage these people to stay hydrated, to take enough fluids, at least 8 to 10 cups in a day. Then also we encourage that the caretakers should not stress these people, to avoid those stressors. We encourage these people to stay warm, to avoid any coldness or cold weather. Then also to take their medicines in time and also to follow up with their doctors. Then for pharmacological, these people always, most of the times they will be in the hospital. And this way, we always manage the pain, and we give painkillers according to the pain management ladder. We shall also give fluids. There's what we call hyperhydration. Then also we do blood transfusion in case the HB is low. Then we shall also go ahead and give other medicines, for example, hydroxyurea, which will help to reduce those crises. Then also we give some folic acid. This helps us to boost or as a supplement. Basically, those are some of the management plans that we have.
For someone listening to us or watching us right now, I'm sure they're asking themselves, how can they really prevent themselves from having sickle cell disease? Mr. David, how can you explain to the community on how they can prevent themselves from having sickle cell disease?
Thank you so much for that very important question. So we always encourage people that before getting married or choosing that person that you want to be with, to always have a sickle cell test done. And as healthcare providers, we shall always take out some samples from both of you. So if the results come out and both of you are normal, we shall encourage you to go ahead and marry. And if one of you is normal, then the other one is a carrier, we also encourage you to go ahead and marry. And if we find out that one of you is normal, then the other one is a sickler, there we also encourage you to get married. But remember, most of your children or all of your children will be carriers. Then there are cases where both of you are carriers or both of you are sicklers, or one of you is a sickler, then the other one is a carrier. So in such cases, we don't encourage you to get married because most of your children, they will be sicklers. So we believe that if people are able to follow all these guidelines, that we shall be able to control sickle cell disease and also eliminate it from our communities. So we pray that everyone will be able to follow these guidelines and know that sickle cell disease is a serious disease affecting our communities. Thank you so much.